Fever complete description. Definition. Fever or pyrexia is a temporary increase in body temperature, often due to an underlying illness or condition. It is typically a sign that the body is fighting an infection or inflammation. Normal body temperature. Range 97 degrees Fahrenheit to 99 degrees Fahrenheit, 36.1 degrees Celsius to 37.2 degrees Celsius. Fevers are generally considered a body temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher. Causes. 1. Infections most common. Viral, for example, flu, COVID-19, DEN. Bacterial, for example, pneumonia, urinary tract infections. Fungal or parasitic, for example, malaria. 2. Inflammatory conditions. Rheumatoid arthritis. Lupus. 3. Medications. Drug-induced fever, for example, antibiotics, antihistamines. 4. Heat-related illnesses. Heat exhaustion or heat stroke. 5. Vaccinations. Temporary fever as a side effect. Other causes. Cancer, for example, leukemia, lymphoma. Hormonal disorders, for example, hyperthyroidism. Symptoms. Elevated body temperature. Chills or shivering. Sweating. Fatigue or weakness. Headache. Muscle aches. Loss of appetite. Dehydration. Increased heart rate or breathing. Types. 1. Low-grade fever, 100.4 degrees Fahrenheit, 102.2 degrees Fahrenheit, 38 degrees Celsius, 39 degrees Celsius. 2. Moderate fever, 102.2 degrees Fahrenheit, 104 degrees Fahrenheit, 39 degrees Celsius, 40 degrees Celsius. 3. High fever, 104 degrees Fahrenheit, 40 degrees Celsius. 4. Hyperpyrexia, 106 degrees Fahrenheit, 41.1 degrees Celsius, a medical emergency. Diagnosis. Physical examination. Medical history. Recent travel, illnesses, vaccinations, or exposure to infections. Tests. Blood tests. Urinalysis. Imaging, for example, chest x-rays, Connecticut scans. Management and treatment. 1. Home care. Rest. Hydration. Light clothing and cool environment. Lukewarm sponging. 2. Medications. Antipyretic as, for example, acetaminophen, ibuprofen. Antibiotics, antivirals, or antiphagants for specific infections. 3. Medical attention. Persistent fever 3 days. Fever above 104 degrees Fahrenheit. Associated severe symptoms, for example, confusion, seizures. Complications. Dehydration. Delirium or confusion. Seizures, febrile seizures in children. Organ damage in cases of prolonged high fever. When to seek medical help. Fever lasting more than 72 hours. Severe headache, rash or neck stiffness. Difficulty breathing. Altered mental status. Let me know if you'd like more details on any specific aspect.